Okay, looks like we've got a good group here. Some other folks are still strolling in, but I'd like to get started. Um, Welcome to today's webinar. I'm Rob Lutz. I'm the editorial director at today's Practitioner. And today's topic is the brain, the gut, and misconceptions on toxic molds and mycotoxins. Now, I'd like to thank my Myco Lab, who's the sponsor of today's webinar. My Myco Lab is a laboratory specializing in blood serum antibody testing for mycotoxins. As I said, I'm Rob Lutz. I'm the editorial director for today's Practitioner. We do have other webinars on the site. You can see it on the webinar tab at the top of the page. Before I introduce Dr. Campbell, today's presenter, I wanted to cover a couple of housekeeping items. We're recording the webinar and we'll provide a link to all attendees. The webinar will last about an hour, and at the end, we'll have a Q&A. And if you would look at the bottom of your screen, you should see a Q&A tab, and you can just feel free to type in your questions there. And Dr. Campbell will try to answer as many of the questions as time allows. So now I'm going to introduce Dr. Campbell. He's a medical clinician, researcher, and internationally recognized expert in clinical immunology and toxicology. He specializes in treating complex chronic illnesses related to toxic exposures, including mold and mycotoxins, Lyme disease, pesticides, industrial chemicals, and immune dysfunction. Dr. Campbell has published more than 100 peer-reviewed studies and textbook chapters, and has lectured nationally and internationally for over 25 years, including at Oxford University and Harvard Medical School. He has served as medical director and advisor to multiple clinical and laboratory organizations and was named Top Medical Consultant of the Year in 2020 by the International Association of Top Professionals. His clinical interests include toxic effects of chemicals, mycotoxins, toxic mold, Lyme, and published studies on these subjects. And full disclosure, Dr. Campbell is a non-paid medical advisor for my Myco Lab, today's sponsor. So welcome, Dr. Campbell. Please feel free to share more about your background and additional context for your presentation today. And thank you so much for being here with us today.
Thank you very much for that wonderful introduction. Let's get started. Basically, I'm going to go over the brain, the gut, misconceptions, and treatment for you so that everybody gets a whole view of everything. These are some of the editorial boards I'm on. This is what my good friend Rob Lutz have just told you. I'm also a fellow of the Royal Society of Medicine in London. I like to say wrong does not cease to be wrong because the majority believe in it. And there's so much misinformation on the internet these days, it's mind-boggling. And if you have knowledge, let others light their candles with it, Sir Winston Churchill. So basically, how do you solve problems of toxicology? You detect the cause, you remove the cause, you repair the damage, and the patient is well again. This is not treatment, this is cure. There's a big difference between the two. So these are just some facts about molds and mycotoxins. When molds start to grow because of being wet or moist, the spores will it'll start releasing spores, and the spores carry the mycotoxins. And so that's how we get them, by the respiratory epithelium, and they then transfer right into the blood and then go to various parts of the body. So molds produce toxins known as mycotoxins, and they're always present in any workplace, home, indoor environment that there's been some water damage. It could be moisture or it could be more. It's much more common than expected in the United States. 85% of buildings have had past water damage, and 43 have current water damage. Now that's buildings, meaning it could be a home, a townhouse, an apartment, a school, a shop, a restaurant, etc. I want you to look at this. Dr. Jack Thrasher, who also published this study, you can see there's 3 columns on the right. The last one, trichothecene, is by far the most common one found inside homes. The column just before that, Ochratoxin A, is not quite as many. And notice that there is no aflatoxin indoors. That is a misconception. It is basically outdoors on things. not inside structures, dwellings, businesses. Two important points. Mold that produces mycotoxins produces a series of mycotoxins, not just one. One mold does one mycotoxin. One mold is several mycotoxins. And so if a mold is that's known to produce a mycotoxin is present in some indoor environment, then the mycotoxins it produces are there as well. This is important. Your hair is about 100 microns thick, human hair. Spores, 2 to 4 microns. Mycotoxins are 0.1, the same size approximately of a COVID virus. So it's mainly by inhalation and absorption to your skin. Ingestion is negligible. Let me take you through all these things. Where do mycotoxins first affect the body? Well, they first affect the body in the brain. Overwhelming, over 30 years, has been well established, brain and nervous tissues. And mycotoxin antibodies will bind to human tissue, including neural tissue such as myelin, and trigger demyelination. And that is one of the most common causes in neurology of what mycotoxins do. Remember that the brain is the only organ completely surrounded and protected by bone. The heart isn't, the liver isn't, the kidneys aren't, etc. And the brain weighs about 3 pounds, 2% of our body, yet it uses 20 to 30% of the calories we consume. And from the carotid and vertebral arteries, it receives the most highly oxygenated blood from the heart. That's how important it is. It uses 20% of the oxygen absorbed by the lungs. How much blood flows through the brain per hour? 13 gallons, or 20% of all the blood pumped by the heart. And there's over 400 miles of blood vessels, mostly, of course, capillaries, that have to reach all 100 billion neurons and cells in the brain because they need nutrients, oxygen, etc. So every person's thoughts, memories, emotions, actions, and reactions are in the brain. And what are some of the neurological effects of mycotoxins? Autism spectrum disorder, decrease in short and long-term memory in adults and children, optic neuritis, chronic inflammatory demyelinating polyneuropathy, Guillain-Barré syndrome, amyotrophic lateral sclerosis, Alzheimer's, multiple sclerosis, movement disorders, Parkinson's, and we'll go through all these from the medical literature. Folks, I want to let you know, I didn't invent, this is not my whatever. I got this by reading medical journal articles. This is not from Google, Dr. Facebook, and various websites. This is from the medical literature. This is a study, 72 children. This is from Tufts University with autism, 61 controls. And the authors showed that in comparing antibodies to mycotoxins between the 172 with ASD and the 61 without, there were elevated serum antibody levels to mycotoxins in the ASD group. Okay, so these studies, and there's several that came out of Tufts University Medical School in Boston, the evidence, they say, implicates mycotoxins as one of the main causes of ASD. On the left, you see me with these twin boys. They're 6 years old here. I first saw them when they were 5. They were completely autistic, repetitive. They hadn't spoken yet, ever a word. They made sounds. They slept about 4, maybe sometimes 5 hours a night. I started treating them. This is their first day in normal school at age 6. They came by to see me after class. And on the right is a picture of me with them when they were accepted at the university, and they both are studying industrial engineering. I wore the same color shirt for the occasion, but I couldn't change the color of my hair. So this is by Dr. Tuminen and her group. And you can see that this is dysregulation of the autonomous nervous system in patients with advanced sick building syndrome, mold. So chronic fatigue syndrome, fibromyalgia, hypersensitivities such as allergies, food intolerance, sensitivity to chemicals at concentrations tolerable by most of the population, sensitivities to EMF, the electromagnetic fields, even to daylight, with maybe associated with mycotoxins. And it goes on to say some of the symptoms are the same ones reported in silicone breast implant patients. So here's what that study showed. It said neurological manifestations in people with POTS, myalgic encephalomyelitis and chronic fatigue syndrome, chronic regional pain syndrome. These are all conditions that are associated with advanced mold-related illness. Now, here are 3 studies, one by a group one from Tufts University School, from Rutgers in medical school in New Jersey. And it's stated that we propose here that fungal toxins, in other words, mycotoxins, are the underlying cause of multiple sclerosis. Okay. And here's 3 studies, follow it, in which this is gone through and explained. So in MS, multiple sclerosis, gliotoxin is the one mycotoxin that has been shown to affect and damage microglia, astrocytes, and oligodendrocytes. And if you remember neuroanatomy, oligodendrocytes are the cells that make myelin. So, and gliotoxin is a neurotoxin. You should not use glutathione or its precursor, N-acetylcysteine, NAC, in patients who have positive levels in their blood serum to gliotoxin. So here's deoxynivalenol, also known as vomitoxin, and it can cause Alzheimer's. T2 toxins change the structure and function in the brain. Here's a study looked at autopsies at different brain regions infected with fungi in Alzheimer's disease. They basically said that all the patients who died with Alzheimer had fungi in all parts of the brain, including the CSF and the blood vessels. Here's a patient of mine. She's wife of a dentist with 2 daughters and grandchildren. She was no longer recognizing her children or grandchildren. Her husband took a picture of her on the left, and she was highly positive for mycotoxins in blood serum. We treated her. This is her in April 24. She specifically told me not to black out her eyes because she said, on the left, I am dead to the world, and the right, I'm alive again. So this is a study published in the journal Toxins of how to biomonitor mycotoxins in plasma, not urine, and Alzheimer's and Parkinson's. So in this study, they took plasma levels 14 mycotoxins from patients diagnosed with neurodegenerative diseases. 44 were Parkinson's, 24 were Alzheimer, and from their healthy companion. They analyzed them and found these 3: elevated ochratoxinase, steric and deoxynivalenol in Alzheimer's and Parkinson's. Here's another study, and this review provides evidence that glutathione is associated with the pathophysiology of Parkinson's disease. So in my patients that are over 50, I don't give them glutathione at all. T2 toxin crosses the blood-brain barrier, accumulates in the brain. Again, gliotoxin increases, the toxicity of gliotoxin increases in the presence of glutathione. And here's the study for you. Here, this is a study on 119 patients. There were 79 females and 40 males, and there were 20 controls. And nerve conduction velocities were done for motor nerves and sensory nerves. The abnormal findings came into 3 groups. One, mixed sensory and motor polyneuropathy, and I'd say a little less than half. Motor neuropathy in about 20%, and sensory neuropathy in about a quarter, 25%. This study was published as a chapter in a medical textbook in Advances in Applied Biology, Microbiology, 22 years ago. Here's evidence of fungal infection in cerebrospinal fluid and brain tissue with patients with ALS. Compelling evidence of fungal infection in the ALS patients analyzed. Basically, they're saying that 5 to 10% of ALS is genetic. The rest is all due to mycotoxins. And here's some misdiagnoses in that people get misdiagnosed with fibromyalgia, chronic fatigue syndrome, chronic Lyme disease. This was a big one. The depression, anxiety that is resistant to treatment. There are a number of psychiatrists that do the blood test for mycotoxins and then treat the mycotoxins, and the depression, anxiety goes away. Autism, PANS, autoimmune disorders, dysautonomia and POTS, which we mentioned, as well as breast implant illness. So in POTS, in myalgic encephalitis, chronic fatigue syndrome, autoimmune disorders, and dysautonomia are linked to mycotoxins. There's another study by Dr. Tuominen. I have published this study in the Journal of Autoimmune Diseases, Autoimmunity and the Gut, showing the effects on the gut. Here's another one on inflammatory bowel diseases. What are we talking? Ulcerative colitis, Crohn's disease, IBS, SIBO, all those, deoxynivalenol. They can also, these mycotoxins change the central and peripheral nervous system and change their function, but also glands of internal secretion, thyroid, pancreas, etc., ovaries, testes. So mycotoxins can cause the development of autoimmune disease, thyroid disease, and type 1 diabetes. And there's millions of people that struggle with Hashimoto's. They eat normal amounts of food, exercise regularly, and keep gaining weight. And their thyroid levels are difficult to treat. This is because the cause are mycotoxins, not the thyroid. So once the treatment for mycotoxins is complete, the Hashimoto's goes away. Here's again, rheumatoid arthritis, well-known autoimmune disorder from this study. Deoxynivalenol, Ochratoxin, increases a person's susceptibility to develop rheumatoid arthritis. And if you already have it, it makes the rheumatoid arthritis worse. So what are we talking about? Here's a patient of mine with psoriasis on the skin, and you can see his ring finger. That's rheumatoid arthritis. And again, look at his ring finger, and this is his abdomen and chest. Here's 6 months of treatment. Enough said. Here's psoriasis, actually the mother of a well-known doctor that lectures a lot at medical conferences, and we've known each other for about 15 years. This is before treatment. Here on the left, before treatment, psoriasis, and on the right, after 6 months of treatment. This is a young girl, 3+ years of creams and steroids, and 3 weeks on itraconazole. Amazing. This is the mother wrote this. My 8-year-old daughter has suffered from eczema for years. I still can't believe it was resolved that fast. Yep. Here's a study on breast implants. So silicone breast implants were first marketed in '62 before the formation of the FDA. So eventually they were grandfathered in without any studies. And they've been causing a problem, and that's the anaplastic large cell lymphomas. Brain fog, hair loss, fatigue, chest pain, sleep issues, irritable bowel syndrome, headaches, chronic pain, autoimmune diseases such as lupus and fibromyalgia. So Dr. Ditchman in Holland did this study, and Dr. Braupar, Dr. Vijdani, and I published about 23 studies back in the mid-90s. And he mentions one of them. And that in that one, we propose that there was evidence of a causal relationship between implants and disease. Well, silicone implants sweat, or they ooze, if you like, releasing silicone particles, and these particles inside end up inside the capsule, migrate into surrounding tissues. So they found silicone in the axilla and groin areas of women with silicone breast implants, and evidence of migration out of the body into the lymph nodes. Here's a breast implant with the capsule removed. This is a silicone one. You can see the implant. It's not clear. It's cloudy. And here's these are saline filled, and again, they're both cloudy. And here's one on the left. That's one that's not been implanted as a comparison to one that's been removed. You see all that stuff inside. Okay. In 200 women with breast implants, positive cultures were found in 68.5% toxic modes. So, what about what we call a colonization? Dr. Ponico, chairman of ENT at the Mayo Clinic, published this study in 1999, 27 years ago. He took 210 patients to the OR who had chronic sinusitis, as evidenced by CT scan and endoscopy. And the treatment he gave was why? Because in 210 patients, when he cleaned out the sinuses, sent it to the lab, asked them, or what did they find? 96% had mold. And he suggested to the ENT Society that they change the term from chronic sinusitis to chronic fungal sinusitis. What was the treatment? Intranasal amphotericin B reduced the inflammatory mucosal thickening on both CT scan and nasal endoscopy. Here's a study on fungi that were found in 35 different cancers. This was published in the journal Cell. They took 17,401 patients with tissue, blood, and serum samples at 35 different types of cancer. Fungi were found in individual tumor types and contributed to the carcinogenesis, esophageal cancer, pancreatic, breast, lung, melanoma, ovary, colon, brain, and bone. And here on the two left-sided pictures, you see the forehead of a man with a huge cancer growth and 59 days of treatment with itraconazole, an antifungal, from this same study. What about, pregnancy and birth? Deoxynivalenol and ochratoxin cross the placental barrier into the fetus. They cause miscarriage, stillbirth, prematurity, small for gestational age, and stunted for gestational age. And mycotoxins were found in 73% of amniotic fluid samples from fetuses with genetic defects. So there you have it. You have a 35% higher probability of stillbirths, a higher number of premature births, and late miscarriages. This is from the journal Toxins in 2023. They may also be complicit in polycystic ovary syndrome and premature ovarian function and endometriosis. So again, that's what mycotoxins do. What do they do in men? They alter testosterone. It reduces the efficiency of spermatogenesis, reduces sperm motility, etc. And zearalenone, which is highly estrogenic, bind to receptors on male reproductive cells. So basically causing almost sterility and very low testosterone level in males. So a study I published a few years ago on Lyme disease and mycotoxins, how to differentiate between the two, because a lot of people are getting misdiagnosed. This study from Germany, and they reviewed all the studies done on Lyme, and this is what they said. PCR, is unsuitable, and ELISpot is unsuitable. That eliminates two of the most commonly used Lyme laboratory tests in the United States. The only one acceptable, also VCS test, CD57, etc. The only one that's acceptable is one produced by Immunosciences Laboratory known as the multi-peptide test, and it's also the only test for Lyme that's been patented in the United States. Here's an important point. Both IgG and IgM antibodies to Borrelia can persist several years despite a clinically healed infection. Okay, so let's go to the gut. It has basically four parts: the barrier function, the anatomical and histological layers, the cell types, and the layers of protection. Therefore, the gut barrier is a totality of three interlaced systems. The first one is the microbiome. The second is the physical and chemical barrier made by the epithelial cells and their secretions, mucus. And third is the immune barrier. Those are the gut-associated lymphoid tissue. 70% of the immune system is in the gut. All three of these work synergistically because we're constantly exposed to things from beverages and foods and things we swallow. Well, the microbiome has the ability to transform the toxicity of mycotoxins, meaning make it less toxic. Two mechanisms are involved. One is the change to the structure of mycotoxins via biotransformation, and the second is by changing the absorption of mycotoxins. So in this study, because of serious concerns for animal and human health, regulatory or guideline levels for deoxynivalenol in food and feed are enforced in more than 40 countries. So all these theories you say, and oh, it's in food, it's in grain, it's in this, coffee, beans, etc., etc. Folks, yes, if you live in sub-Saharan Africa, Eritrea, and various, Togo, some of the South African areas have this problem because it's not well regulated. Also in Western rural China. For instance, milk. This was by Dr. Frey and his group, and showed that there's 1 to 4 mycotoxins in the milk you buy in the milk carton at the supermarket. 91% of all the milk tested had at least 1 mycotoxin, and 30% had 2 to 4 mycotoxins. But the levels were below TDI, tolerable daily intake. That's parts per billion. What is a part per billion? I asked a physicist once. I told him I was a visual. He says, take 1,000 football fields, cover them with golf balls, remove 1 golf ball. That's 1 part per billion. So there you go, folks. It's so small that we easily excrete in urine. And as it said in this study, easily excreted in urine, as are most mycotoxins found in beverage and food. That is why testing for mycotoxin urine is not helpful in assessment of mycotoxins from any indoor space. And another reason is the amount of mycotoxins tested in foods in numerous studies are below this TDI of 10 parts per billion that's set by the FDA, the EFSA, the United Nations, the World Health Organization. And from this study, again from the journal Fungi, one has to admit that today the risk of acute intoxication in humans is low, at least in developed countries where the amount of mycotoxins in food items is controlled by authorities. And here's an example. Look at the last 3 lines. An adult weighing 170 pounds would have to eat oat flakes that are moldy. How much? 14.3 pounds of ready-to-eat oatmeal porridge, or 20 slices of bread. Well, who's going to do that? And if you look above, if a 2-year-old child with a weighing 28 pounds would have to eat 38 ounces of ready-to-eat oatmeal porridge or 3.5 slices of bread. I don't know of any 2-year-old that's going to do that. And low levels of mycotoxins are found in a lot of foods, cereal, beans, etc. And this is well known. For that reason, mycotoxins can be found in urine in healthy people. What do they say in this study comparing urine mycotoxin and serum mycotoxins? The ELISA method, which is enzyme-linked immunosorbent assay, the ELISA method, that's the one used by my microlab to detect mycotoxins in human serum, comes with significant accuracy, precision, and specificity. It's at 98%. Now, what do they say about the urine in this same study? Well, the variability of mycotoxin concentrations in urine and its volume based on daily intake demands urine sampling at different time points during the day. And then the inter-individual comparison of mycotoxins is challenging because various factors such as what is your gender, how old you are, your diet, your muscle mass can influence creatinine secretion. That's why they don't recommend it. And of course, there's this by the CDC. It's not a validated test. Now, ever wonder why the CDC doesn't recognize urine mycotoxin? Well, both the CDC and FDA don't recognize it for the following reason. It's not FDA approved. These labs aren't validated through the FDA standard process of diagnostic tests. And the exposure does not mean disease. The CDC points out that almost everyone is exposed at some levels of mycotoxins through food. So a positive result doesn't mean you're sick from it. And the lack of standardization. In other words, different labs use different cutoffs, methods, and interpretations. This means 2 tests on the same person to different labs could give you different test results. Well, enough said. So here is what they consider the most accurate and precise test for mycotoxins from my microlab. You get both IgG and IgE measurements. Now, I want to explain that a little bit. The IgG antibodies, if it's a pathogens, and in microbiology in medical school, we learned that there's 4 pathogens: bacteria, pathogenic fungi, viruses, and parasites. An antibody to those later on indicates that sometime in your life you were infected by these, and it keeps that IgG antibody forever. Well, what about if it's a toxin? Those 4 pathogens are living organisms with cell membranes, etc. Mycotoxins, like most toxins, are molecules. Mercury is a molecule, Hg. Glyphosate is a molecule. Arsenic is a molecule. The immune reactivity is different. IgG indicates how much is in the body at this time. The IgE, under normal circumstances, indicates an allergy. So if you have IgG to molds, it means you have mold allergies. You're allergic to molds. You start sneezing, itchy eyes, itchy nose, things like that. But these are toxins. They're molecules. So when you have an elevation of IgE antibodies to mycotoxins, that indicates it's in your environment at this time. Workplace, home, the gym that you go to work out every day, your car, your school, if you're in college or you're a child or adolescent, etc. And if it gets very high, it can result in mast cell activation. So, having said that, here's on the left IgG and on the right IgE. Obviously, these are elevated. This person remediated their house and then did the treatment, and this is the result after 6 months. You retest after 6 months, not after 2 months, You don't retest every 3 months or 4 months. No, this is an immune reaction. You retest after 6 months. Here's something interesting, because doctors tell me every time they do a urine test, they find ochratoxin. Well, this is a study published in Molecular Interaction, Ochratoxin A, about just ochratoxin A. Albumin is the most abundant plasma protein in the circulatory system. Albumin binds to ochratoxin A with unusually high affinity. 99.8% of ochratoxin is albumin body bound. Due to this, its elimination by glomerular filtration is negligible. Studies verify that the toxin is able to be reabsorbed from practically any part of the nephron in the kidney, both by active transport and by passive diffusion in a pH-dependent fashion. So how can they find it in urine? Well, you can figure that out on your own. Here's a study that was just published in April of 2025. Basically, they are saying that T2 toxin in urine 80% of the time is inaccurate. Wanted to bring this testing up. They took, that was published in the journal Access to Microbiology, stools from a healthy person that were screened for different bacteria and parasites. Then that stool sample was spiked with 14 bacterial pathogens and 2 parasitic pathogens. They sent it to 2 different labs. One lab was specific 100%. The other one, GI map, was specific only 26%, meaning 74% it's not specific. So you know where to send stools. And then in this study, several popular organic acid tests claim to detect imbalances in gut bacteria and fungi. But most of the microbial markers of these tests do not measure what they claim to. And many labs focus on the levels of chemicals measured in urine. But this is an indication of chemicals that have already passed out of the body. You should measure the immune response to chemicals, emphasizing the importance of new antigen formation and chemical body burden, because it gives you the body burden. IgG to mycotoxins indicate the body burden. What tests with no medical evidence linking it to anything to do with molds and mycotoxins? All these tests. And I see people wasting good money, but there isn't a single publication linking them to anything dealing with molds or mycotoxins. And there's 32 million studies in PubMed.gov, the National Library of Medicine. Marcons doesn't exist in medicine. It's a imagination of some people out there on the internet who think it's a reality. VEGF is used in patients with lymphomas and leukemias. The VCS test, there's nothing linking it to molds or mycotoxins. And again, Marcons has not a single study showing it even exists in medicine. The other sham test, the HLA-DR test, it's supposed to affect 25% of the population, meaning 82.5 million people in here in the United States are affected by the test. But there's no published studies relating HLA-DR to anything with molds and mycotoxins. There's one study where they studied 4 people. Well, studying 4 people doesn't mean that it's going to affect 82 plus million Americans. There's no research. It is not taught in any medical institution, has no basis in medical science. But let me ask you something. I know of a disease all of you have heard of, everyone in the public has heard of, people without any medical training have heard of it, and it affects 32 million Americans. It's called diabetes. This one, 82 million, 50 million people more, and nothing's being done about it. Wow. Here's another myth. mycotoxins colonize the gut, so I have to pull them out with binders. That's a fabulous myth. So let's look at the studies. Let's look at the medical evidence. This study says binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream. They looked at kaolinite, clays, activated charcoal, zeolinite, bentonite, etc. And they're effective in neutralizing aflatoxin. If we go back to the beginning, you remember where I showed you that chart that aflatoxins are not indoors? And outdoors, we don't catch it because it's on leaves, trees, plants, insects, etc. We don't get it as humans indoors. They also said they're ineffective in all other mycotoxins. And on top of that, they bind vital vitamins as well as macro and micro elements. And that includes not only these, but hormones. If a person is taking a thyroid hormone, a hormone for any purpose, estrogen, progesterone, testosterone, birth control, etc., it binds those too. So binders are not at. Here's another study. Some physical strategies, such as the application of adsorption agents, binders, presented no sufficient effect against mycotoxins. And this is in humans. Binders do work in sheep, goats, rabbits, fryer chickens, and piglets. I don't treat those. What about the ultrasensitive patient? Well, that's the one that's taken too many supplements. I have patients come to me with a shopping bag full of 20, 30, 40 supplements. And of course, there's mast cell activation syndrome. Basically, the wrong diagnosis with the wrong treatment gives you a chronically ill patient gets more and more sensitive. When they have the right diagnosis and the right treatment, patient gets well in about 6 months as no longer sensitive. What about supplements? This is a study. They took 60 dietary supplements and tested them for what they had in them and compared it to what's listed on the label. 11% had in them what was listed on the label. 40% had nothing in the bottle that was listed in the on the label. So what are you going to do there? Here's 40 different supplements examined for the presence of lead, arsenic, mercury, cadmium, or pesticides, and they found traces of one or more of these in 93%. One study reported botanical supplements containing plant species not listed on the label. Additionally, active ingredient substitution was observed in 83% of the companies tested. So all of you that buy online or what, et cetera, that's the wrong treatment. The only company I know of, the only lab that I know of that has 100% purity as done by third-party testing is detoxpure.com, and that's the one I use in patients. Now, what about antifungals? Fluconazole has a limited spectrum of activity. For example, it's not active against Aspergillus and several species of non-albicans candida. Here is a very simple chart for you. Here's yeasts. Yes, it works against yeasts. It does not work against Aspergillus, Stachybotrys, Penicillium, Cladosporium, but Ochratoxin does. So what is the treatment for the chronic sinusitis study by Dr. Panicow? It's amphotericin B nasal spray in a 0.03% saline, normal saline solution, and itraconazole 100 milligrams twice a day with food. Itraconazole oral solution and intravenous formulations, a review of pharmacokinetics and pharmacodynamics. This was published in the Journal of Clinical Pharmacy and Therapeutics. It's an antifungal with a broad spectrum of activity. It is well tolerated and highly efficacious. That's what we want for our patients. Ochratoxin produce consistent plasma concentrations. They're ideal for the treatment of fungal infections in a wide range of patient populations. And it can be specifically tailored for use in all patients, including children and those requiring intensive care. Here's another study. Ochratoxin, also known as Sporanox, etc. It's been in clinical use for 35 years with an established safety record. How to dose it. That's 100 milligrams twice a day with food for better absorption for 6 months if you've tested positive. This is the dose from start to finish, and don't use the pulse method. That's only for toenail fungus. That is not used for humans inside problems. Here's another study. An underlined part, ochratoxin has been proven a valuable addition to the antifungal drug currently available for treatment. It has been well tolerated with doses up to 400 milligrams a day, generally free of serious side effects. Well, folks, if you go to Dr. Google, they're going to tell you your liver is going to fry, your eyeballs are going to fall out, your teeth are going to rot, and all kinds of things. But this is medical evidence from published studies. How long is the treatment? 6 months. First rule, get the patient away from the toxin or the toxin away from the patient. That's the first rule of toxicology. Second, ochratoxin 100 twice a day with food. There's 8 specific supplements and vitamins at specific doses. Why do I say that? Because in medical journals, they don't say take vitamin C. They tell you take this type of vitamin C at this dose, this often for this long. It's very specific. And then a low histamine, anti-inflammatory nutritional diet. That's to get rid of your toxic mold mycotoxin problems. Here's what a clinician said. Dr. Campbell, I'm simply blown away with your knowledge base after hearing you at A4M. I dove into your videos. I wish I'd met you years ago after getting sucked into the Shoemaker Nathan vortex. At least going forward with your directions, I'll be able to truly help my complicated patients. And this is from a healthcare provider. Thanks so much for your help. I really do appreciate it, especially your YouTube videos, knowing that my own family has been exposed. We all just recently had our serum blood test done. And as someone who has previously tried the holistic route, I can say for certain that it does not work. So here's a young lady. She wrote this and sent me this. So you can see pre-ochratoxin June 2021, SIBO. And then 3 months later, first morning, I've woken up with just about a completely flat stomach with no bloating. I'm still dealing with some issues as the day goes on, but nothing compared to what I used to be before. Here's a medical mast cell activation patient. You can see on the left, her back, she had it all over her belly, arms, back, abdomen, legs, etc. And here she is after treatment. Obviously, she's well. Folks, this is used by so many of these inspection companies, but what does the United States Environmental Protection Agency say about this test that they developed? And if you look in this right-hand corner at the bottom, it says, this was said in 2013, in the summer of 2013. That's 13 years ago. Public may be making indoor cleanup decisions based on EPA tool developed only for research applications. It should not be used. As I come to the end, I'm going to give you these. This is the invisible enemy, fungal toxins, mycotoxins, the great masquerader of the century. It's the journal Pathogens. As you can see, it has an impact, considerable impact factor of 3.3. It's indexed in PubMed, and I am the guest editor. Any of you listening in want to submit a study, please let me know. And this special issue will go out. Deadline is the last day of September. And it's 2026. That was a mistake there. So Here's my email address at the top. If you have any questions, these are just over 100 studies, but these I thought you may be interested in: molds, mycotoxins, the brain, the gut, misconceptions, with Dr. Weinstock, a gastroenterologist. Molds, mycotoxins, their effect on children, Lyme disease and mycotoxins, how to tell between the two, the brain and mycotoxins, and this with Dr. Vajdani, Dr. Pollard at UCLA, and I, environmental triggers and autoimmunity in the journal Autoimmune Diseases, in a special issue on environmental triggers and autoimmunity. So basically, I tried to put a lot of things, but of course, time is always a limitation. I'll be happy to take any questions you may have.
Dr. Campbell, there are a few questions if you click on the Q&A, and I think also there have been some questions that had come in earlier as well. So do you see those there at the bottom of the page? Right in the center at the bottom, you'll see Q&A.
Let's see. I see participants share more. Okay. Q&A. Yes, here we go. Has FDA approved the MyMycoLab test? Yes, it's been actually in use for 25 years or more. So it's not new. How long have you been using BioFire Lab? What tests are you recommending? Are they able to identify fungal infections? I suggest those are questions for them that you should ask, because if I just say this or that and briefly here, you might have other follow-up questions. So just go to the study and that'll help you. I use amphotericin B nasal spray in most patients? I do not. I use it only in patients who complain of chronic sinus issues. And I'm ready for more questions. I welcome them. Oh, here's some more. What are the 8 vitamin supplements you recommend with treatment? Please go to detoxpure.com and you can find them there and the right dose, etc. Who owns MyMycoLab? It's a group of investors who own it. A group of people, I should say investors, because I don't know if they are investors or not, but it's owned by a group of people. Is mold implicated with cartilage loss, osteoarthritis? Molds, no. Mycotoxins, yes. And do EMFs make the toxin more active? No, it doesn't make it more active. That's one of these things floating around on the internet. No, it doesn't make it more active. Why shouldn't glutathione be used for certain mycotoxins? Can you please explain further? As I explain, and you can review this, I'm sure, it's for gliotoxin, not all mycotoxins, gliotoxin, and the study is right on that slide, so you can look up the study. Essentially, it makes gliotoxin more toxic. Again, for the 8 vitamins, the dose, and all that, just go to detoxpure.com. On a patient, do your mycotoxin test? Yes, positive results. How high does the level need to be considered too high and needing treatment? Let me ask you this, doctor. How much mercury in your blood before you start treatment? The answer is you don't want any, and any amount in your blood is worth getting rid of. Have you believed that mold testing in one's home be done first before treatment? I believe, first of all, the testing, the inspection for molds in homes is not a regulated industry. As a result, I've had people use one company and do the blood tests. They're positive. They use another company, and the first company said, no, there's no mold. The second company says, yes, there is. It's very iffy way, unfortunately, and it's the hardest. On YouTube, I have a couple of videos with a young building engineer whose name is Brantley May. I suggest you watch those because he goes through every type of test, the pros and the cons, so you use the best one. Do you find that you have to do mitochondrial recovery in some people who have long-term exposure? No, because okay, what do these molecules do? We're talking now at the molecular level. What do? They enter the mitochondria, cause mitochondrial dysregulation, and from that, cell apoptosis, the cell dies. Okay, so how are you going to do mitochondrial recovery if it's killing the mitochondria? So the point is, you first do the treatment, and then you won't need to do any mitochondrial recovery. And also, if there's any studies on that subject, because I've not seen any, please, via my email address, let me know. Since there are 100 mycotoxins, and the tests are for 14, I'm not sure where you get the idea that there's 100 mycotoxins. Yes, there's a million molds out there. There's molds that affect certain plants, certain animals, certain insects. There's aquatic molds that affect certain aquatic plants, certain crustaceans, certain fish, etc. But I'm only interested in the ones that cause disease in humans. If one tests positive for mycotoxins, do you treat yourself? If one tests positive, well, if the patient is positive, it needs treatment. Anyone can order the testing. I live in Charleston, beautiful city, fantastic, and the food, oh, it's wonderful. And mycotoxin are outdoors, air, and everywhere. Excuse me. Per my phone. There's again million molds out there. But what do the studies say? The studies say, well, first of all, there's breeze, winds, etc. Second, there's sunlight. Where do molds like to grow that create mycotoxins? Dark, moist places with very little air circulation. Like, for example, basements are typical. So, my home is clean. Is it possible I can't get away? No, it has nothing to. Okay, I did all my studies in Switzerland, and when I was in prep school, my brother was at the university in architectural school in Switzerland. He stayed. He's still there. And I asked him once when he came here to visit me and our mom. I asked him, what about molds and everything else in Europe? Because we have. I mean, obviously, I have patients all over Europe, all over the Middle East, Central South America, New Zealand, Australia, etc., Cambodia. And I say, why is it all over the place? It's in Dubai. Dubai, when you leave the city, it's sand dunes all around you. I mean, there's no trees or vegetation, nor rain, nothing. It's like Lawrence of Arabia. So how come this? He said, very simple. It's not climate, it's construction. What do we use in the United States? Cinder block, and we use brick. These are all porous. They absorb liquids, including water and rain. We use wood. We use drywall. All those suck moisture. That's why the problem is. Do you know if mold plays a role in how to deal with pulmonary influenza? What I can tell you is that molds are known to cause pulmonary issues. For example, one diagnosis is pulmonary aspergillosis. I can also tell you that during the pandemic, there were several studies published. One was published just after the pandemic ended, I think in 2021. And it showed that patients that they had on respirators when they were treated with otrconazole got off the respirator within a week. And within 2 weeks, they were discharged from the hospital. The second study showed that with COVID again, a place, I think in New York City, that was a long COVID treatment center. They took 100 patients, treated them with otrconazole, and they got well. And the third study looked at why. Well, they said because during the pandemic, nobody went out, they stayed home, and they were in a moldy environment. That's where we get that. You run total titers of IgE and IgE to make sure that immunosuppression is affecting the biological lab test results. Well, I can tell you, if a patient has low IgGs, they have chronic infections since basically as an infant, they start having chronic infections. And remember that IgG antibodies have 4 subclasses, IgG 1, 2, 3, and 4. And IgE, total IgE only tells you if you have a little more IgE or not, and that's not going to affect the test results at all. Oh, I see. I mean, are you the prescribing doctor? Or, no, you have to find your own doctor to help you, etc. Any other questions?
All right. Well, Dr. Campbell, thank you so much. This was an incredible presentation. Really appreciate your time and expertise. And I appreciate the audience with all the great questions. So we will be posting the recording on todayspractitioner.com, and there'll be a follow-up email to all attendees with that link as well. And appreciate everybody, and hope you all have a great day. Thanks so much.
Thank you so much. Everybody have a wonderful day. Bye-bye.